Good evening, everyone. Welcome to our May webinar. This evening, we will be talking about how to set expectations from therapy. We will be talking about certain things that people tend to oversee when they set expectations, so they set them too high. And we'll talk about factors that might actually favor having higher expectations. And hopefully, by the end of it, you will know what to think about so that you can make an informed decision and so that you can set healthy expectations. Either too low or too high expectations are not going to give us the optimal results. In the end, we will address this topic as well, which is what is it that's most useful to strive towards, reduction of pulling or completely stopping pulling. I will try to give you as concise an answer as I possibly can to this. So as we go through this webinar, we will discuss different first general issues, then specific issues that pertain to BFRBs and of course hair pulling in particular. And then we'll talk about some things that might favor a faster recovery, certain factors and skills. And then in the end, we will head-on address this issue of reduction versus stopping. Because this is not only a question of your expectations, it's also a matter of how you set goals and what is it that you ultimately strive to achieve. I will try to keep it down to earth and practical. I will mostly draw on examples from my own clients in therapy, so that you see where is it that they usually, what is it that they fail to calculate in when they factor in when they decide what is it that they're supposed to achieve in therapy. As I go through the program, through the webinar, as always, you can ask your questions and I will respond to all of them or most of them, at least in the Q&A. So let's get started. First, we will address some general issues. First of all, when you decide to change, I'm not talking only about pulling here, but in general, when you decide to change, there is a certain way in which you change most easily. And let's say we can say that we all have our own implicit theory of change. So the first thing that you need to look at is what other changes you've made in your life, whether they were intentional or spontaneous, and then see how those changes took place. How fast were they, or how slow were they? What was the process like for you? Are you the kind of person that just jumps in and does it all at once? Or are you the kind of a person that postpones change until the very last moment? Are you someone who changes quickly, or are you someone that needs more time? What are certain pitfalls that you encounter on your way typically? Why is this important, you might ask? It's a rather, I know that these questions may sound kind of vague and not related to pulling, but they really intimately are. Your typical pattern of how you change will determine how you will change with this specific issue as well. So if typically you change very slowly, then it is not reasonable to set an expectation to completely stop pulling in, 2 weeks or a month. So when you get to know your patterns, you will know roughly what you can expect. And then you can work with this. Maybe it'll take a little longer, maybe it'll be a little faster. It depends on the kinds of changes you went through, and let's say how you rank pulling in that overall hierarchy of problems that you're dealing with. But this is quite an important thing, and this is something that I actually quite frequently encounter when I start working with clients, and then they will come to therapy and they will tell me well, I've been struggling with BFRBs for 25 years, so I plan to quit in the next 2 months. And then I ask, well, how did you get to this? How did you get to this number? Why 2 months? And then they say, well, that just seems reasonable. Like I should be able to do that. And then I start inquiring about their history, and then they'll tell me something like, it took me 7 years to overcome my drinking problems. as an example. Uh, and then I think, okay, so it took you 3 years, but now you suddenly think this should take 3 months, and the problem was present for a long time. So it doesn't quite add up. And people seem to be oblivious to this because they look at pulling and then they say, well, that's just this little thing. It's just this habit that I have. So they basically minimize the problem and then base their expectations out of the context of their lives and with the assumption that it's just this simple little habit. So immediately there you set yourself up for failure because your expectations are made completely without taking into account how is it that you actually change. Even when you recognize that pulling is a problem and something that's definitely important to deal with, that doesn't mean that you're actually in that place to be ready to start working on it. So having this insight that pulling is a problem and seeing its consequences, even experiencing tremendous suffering, doesn't mean that you will actually be ready to change and that you will be ready to give up pulling. There are many things that I would like to change about myself that I think are not the best, but I'm still not going to do that anytime soon because I just don't think of them as priorities. There are certain other things that I feel like I need to work on. So right there, you need to be very honest with yourself. Are you ready or able to make this a priority in your life right now? If you're not, that doesn't mean that you shouldn't seek treatment. It just means that you need to adjust your expectations to exactly, how high or low dealing with pulling might be in your current hierarchy of problems. And then you need to take one step back and say, okay, maybe I feel ready to finally tackle pulling. And let's say that you feel reasonably motivated. You might start therapy and then discover that pulling is actually related to some other issues that you're not willing to tackle. That means that you might reasonably expect a reduction in pulling, but unless you deal with the other associated topics, stopping altogether might not be realistic. What happens quite frequently in therapy is that people will come, they'll be very motivated, and then they will discover that pulling has to do with one of their important values. Specifically, what comes to my mind with many of my clients is being productive. And then because at some point they realize um, that pulling directly comes from the fact that they're overworked, for example, or that they devote so much energy to their career that they are simply burnt out by now. And then there's a choice to be made. Can I work less or change the way I work in order to give up pulling? Or do I want to continue things as they are? And I don't know if you'd be surprised, but very frequently people say, well, let's just keep the pulling and continue with things as they are. So this is something that's not always easy to predict. Maybe you have this idea already where pulling might link into and what it might be connected to. In that case, you can perhaps make a more informed decision. But this part is something that people usually discover as they start treatment, which tells you right away that the expectations that you set cannot be set in stone. You have to be willing to revise your expectations as you go through the program. Something that might seem easy on the surface could prove to be quite difficult and complicated once you scratch beneath the surface. Right. So readiness for change is another major one. And the takeaway from this specific slide is that just understanding that pulling is a problem doesn't make you ready or willing to change. And saying that you're willing to change kind of intellectually doesn't actually mean that you're willing to change. You have to be ready to give something up, to lose something, to put in the work, to have the discipline. All these factors will tell you how ready you are to change. If you're not ready to change, you can still start therapy and then work on readiness. That's quite a legitimate topic in therapy. But that just means that you should expect a longer journey. So that change for you will last a longer period of time. And also, it doesn't mean that you cannot expect reduction in symptoms, only that you might you might expect a slower reduction in symptoms. Then there's this other question of your motivation for change. Why is it that you actually want to change? It might seem like a ridiculous question to ask, considering, how difficult pulling is, but it's a question that people really should be asking themselves more frequently. Uh, what happens in therapy, it doesn't happen in most cases for sure, but it does happen, and it's not rare that I hear this, that people want to change because of a person or an event. So I cannot tell you, actually, this morning I was talking to a colleague of mine from Trickstop, and we were discussing how many people actually decide to change because they have an event coming up. Like, I have a wedding next year, so I would like to stop pulling by then. That would be one example of motivation that isn't the one that actually yields the best results, right? Or sometimes people will feel pressured by their parents or by their partners. Sometimes shame is what will get you to decide to change. In all of these cases, change is of course possible, but I would set lower expectations. There is a huge difference between changing because something doesn't align with your values and because it doesn't align with how other people see you. The latter is important, or actually, let me correct that, may be important, because personally I care very little. But for many people, that is a source of motivation. It's just that that one will only get you to reduce your symptoms up to a certain point. When you start changing for other people, what frequently happens is that you stop at that point where they no longer see the problem. So for the outside world, perhaps your hair looks excellent, but you might still continue to pull in private. Or you might change your pulling sites so that people cannot see that you're pulling. Because shame is only concerned with how we compare to others and whether or not we meet their expectations. Shame as a feeling doesn't actually carry a message about how we see ourselves and what we want to become. A part of you could still be very much okay with pulling because of the rewards it brings. So that's one thing. Again, change still possible, just it would be wise to lower your expectations. On the other hand, if change comes because you are privately, kind of intimately fed up with pulling, and you feel ready to become a different kind of a person, then you have much greater chances of creating, let's say, long-term change and sustainable change, because that's what we care about. When it comes to people who want to change because of an event, what usually happens is that they will really work very hard until the wedding or the trip or whatever it is, and then suddenly they will have a relapse, because once the event has gone, the motivation is gone also. So in those cases, it might be realistic to expect longer relapses. Relapses, as you will see, will happen either way. But if your motivation is only valid up to a certain date, then what you can expect is not only a relapse, but maybe a return to how things were. So be very clear about what you want to change, and let that be a major factor in how you define what your goals and expectations are. Another thing that presents an objective limitation is how therapy actually works. This is also something that I very commonly see. And I don't know why that is the case, but I don't see that as much in my private practice, like in face-to-face work, but I do see that with Trickstop. And I don't quite know how to explain that, except that in my private practice, people pay much more money, so they're, I guess, more willing to open up and work and then listen to me, whereas Trickstop is kind of more affordable, I think, and then people take it differently. As weird as that sounds, but cost of therapy does affect how invested people are. But therapy is not fast. Like, I know that CBT is aggressively advertised as this quick, no nonsense way of changing, but that simply doesn't correspond to reality. It just doesn't work that way. There are no quick solutions when it comes to psychotherapy, and there are no life hacks or shortcuts of any kind. CBT is practical, but practical is not the same thing as quick. Some people will implement CBT techniques quickly, so they might say that for them CBT was fast, but for most people it is a process. So don't think of therapy as a quick solution. In fact, if you're seeking a quick solution to a psychological problem, I would spend some time contemplating that as well. Because optimally, what you want to achieve is a solution that will be permanent or as long lasting as necessary or as possible. So there are no hacks when it comes to that. On the other hand, people will often come to therapy and then say, well, I'm very intelligent. I've read all these books about psychology and I'm very introspective. I know myself very well. That's lovely, but it still will not increase your chances of changing faster. In fact, I've seen in numerous cases where intelligence actually acts as a tool of resistance rather than change. Insight is important. I guess I wrote here that it's necessary, and personally I believe that, but theoretically I don't think it can always be defended. But we can say for sure that insight is extremely important. But just having this intellectual understanding of how your pooling operates, what triggers it, what emotions are underneath it, that alone will never be enough to produce change. And we know this is not something new. We've known this ever since Freud. So this is one of the oldest insights that we have into how humans change. Freud wrote in numerous places that having an insight into what caused your problem or into the mechanics of the problem itself doesn't lead to change, but what leads to change is something that he called working through. So you actually have to embody the insight in your everyday life, and that takes time, because that means adopting a whole different mindset with completely different guides for action than the ones you had before. So if you think of therapy as something that is quick and painless, especially painless, because therapy is never painless, you're very likely to fail in your own eyes. Because you will run into this nasty little thing, which is that humans change very slowly. So having that belief would be a hindrance, actually. So not only is it an unrealistic expectations, it's something that is also likely to lead to frustration. So have in mind that it might not take years, but still it is not going to be a matter of a few weeks. And I have to be very direct about this because this is something that I work with daily. Most of my clients have, for some reason, this idea that, just if I find this one competing response and like a kind sentence to say to myself, and I'm done. And that's just not how it works. In fact, we know, of course, from research that therapy is superior to medication when it comes to BFRBs, but even when medication is effective, it is never effective quickly. It's, even let's say you're depressed and you take antidepressants, they still are not going to help you within a day. You will see their effects after, a couple of weeks, but for them to have a full effect, it takes a long time. So therapy is no exception. So another thing that you need to keep in mind is that you cannot expect treatment to be linear. So it doesn't go from I'm pulling to I'm not pulling. I have been working as a therapist for wait a second, for 12 years now. No more, actually, 14 years now. I'm really bad at math today, but over a decade, let's say. I have never seen a client who managed to change without having some relapses or setbacks, because people are just messy. Our psychology is messy, it's inaccurate, we're just not machines. So you will fail. There's absolutely no doubt there. If you're, in all honesty, going through a therapeutic process, open to trying new things, some of these new things will be failures, and that's fine. When you encounter failure, you can either get frustrated or you can learn from it. And when we do the latter, that's what we call psychotherapy. So also keep in mind that Even if you're able to change very quickly, it's not going to be smooth sailing no matter how motivated you are. Expect setbacks and relapses and work that into your expectations. So don't be surprised when it happens. In fact, when you start working with a therapist, you can actually discuss what to do in case of a relapse as soon as you start getting hold over pulling. Also expect resistance to change. That's normal. Expect anxiety and expect frustration. Change by definition means that we start doing things differently. And if we're doing things differently, that means that we have to have a certain degree of anxiety, because anxiety is what we feel when we find ourselves in this new space, physical or psychological, when we still don't know what to expect. Doing differently precisely means that, not knowing what to expect. So if you have, for example, trouble tolerating anxiety, that means the change might be slower for you. If you're willing to kind of tolerate anxiety, threat, guilt, anger, and so on, you might change faster. Again, something to consider when you think about how fast you should change. And I made this point precisely because quite a number of people who struggle with BFRBs actually have a problem tolerating their intense emotions. That's kind of the core of the issue in many cases. So this means that slower pace of change is something that's more realistic to expect. Let's now address some specific issues. First is time, not in terms of how old you are, because that doesn't play a role. I've had and I have clients that are over 80 and they still manage to change. In fact, I find that clients who retire and then come to therapy tend to be very disciplined and very dedicated to change. So I'm not talking about age here. I'm talking about how long you've been pulling. That's a completely different thing. The longer you've been pulling, the harder it is to change it. So keep that in mind. This is because pulling has a habitual aspect to it. And when you have a habit that's been present for 10 years, it's certainly going to be more difficult to break or replace than a habit that's been present for 2 years. So this is quite an important point. And the second thing is that symptoms are like onions. Like the longer they last, the more layers they have. For example, pulling might start because, I don't know, let's imagine, I don't know, your mom taught you that hair is extremely important and that it should be a certain way, that you don't like curly hairs or those frizzy hairs. So you pull these as a way of wanting to look good. Soon you discover that pulling actually is kind of soothing. So as you start high school or college, and when stress accumulates, maybe pulling becomes a way for you to relax a little bit, to get some kind of gratification. Then let's say college becomes more stressful, or you start working and you don't feel like you're very successful. But pulling gives you a sense of accomplishment. So here's another layer that pulling can take over. Then you work more, and most people that I work with and that I know are frankly overworked. So you feel tired, exhausted, and stressed. And then pulling is this little escape from reality. Here's another layer. Or you might discover that it's hard for you to focus on something. But then when you start pulling, perhaps even mindlessly, suddenly you can focus because you have all this restless energy that you can channel into something. Here's another layer. And when you change, if you want to eliminate a behavior, you have to peel off all these layers. This can take some time. The examples that I just gave you are some things that I typically see, but every person has a different set of layers. So in that sense, I can't predict, and neither can you, what are the layers that we will discover as we start peeling the whole thing off. So the more layers there are, the more difficult it'll be to untangle them all. That's another thing to expect. And this is why time, when you pull for a long period of time, it means that you might take a lot of time to recover from it. Then we have the focused versus automatic pulling. If your pulling is mainly mindless or unconscious, that might mean that you will need a little more time to achieve your desired results. The reason why automatic pulling can be so stubborn is because, first of all, you can't prevent something or stop something that you're not aware that it's happening to begin with. So to change, you need awareness. So it takes time to develop awareness. But at the same time, uh, automatic pulling usually has this, it's difficult to pinpoint what triggers it, what emotions or thoughts are underneath it, and then that makes peeling those layers additionally difficult. If your pulling is mostly focused, then it's easier to understand and to deal with. For most people, as you know, it's a spectrum. It's not like either or. Most people have a little bit of focused, a little bit of automatic, so they have both. And in that case, the question for you is which type is more prevalent and how aware of it you are. Not aware that you're pulling in general, but in the moment when pulling starts, how much awareness do you have? So you need to factor in that there will always be a period of working on developing awareness. There's no therapy without that. So that's how you start every time. But if your pulling is mostly mindless, you will need a longer period of time just to become more aware of it. So if your pulling, just to summarize, is dominantly focused, therapy might be faster than if your pulling is unconscious. So keep that in mind. Another important question in terms of how, so I hope you understand that I'm not only here, that I'm not only talking about, your motivation to change. I'm talking about things that also feed our resistance, things that might help us rationalize why pulling is maybe okay right now. Why might no one see it, and things like that. So we're talking about objectively what's more difficult to change. And then we're also talking about certain aspects of pulling that might feed into your resistance to change. And there is always resistance to change because symptoms always have a function to perform. And as long as they have that function to perform, there will be some degree of motivation to keep them, even if 99% of you wants to get rid of it. So back to where. Where means two things here. Where, as in, do you ever pull in front of other people, or do you just do that when you're alone? If you only pull when you're alone, it might be difficult to be accountable to yourself. In which case, the question is, are you willing to bring in allies into the treatment? People who will be able to hold you accountable. If the answer is no, change might be slower. If the answer is yes, you might be able to change a little faster. Another thing is what are the actual pulling sites? If your pulling sites are visible, you might be additionally motivated or driven by shame to actually deal with pulling. If your pulling sites are not visible, then it might be easier to actually kind of keep pulling a private thing, and therefore it might be difficult to stop because we have less of an incentive to deal with it. For example, I find that people who pull their pubic hair tend to have trouble stopping. It's actually weirdly easy to resolve technically. It's not difficult to come up with techniques to prevent that. It's just that the willingness is missing because that is a pulling site where no one can see that you're pulling. So it kind of gives you permission to continue just by the virtue of being this invisible private pulling site. So that would be also important to consider. And then we have a more psychological or even philosophical question, if you will, but still quite significant. What kind of hair do you want to have, and what kind of hair are you pulling? What does hair actually mean to you? I've had clients where pulling their hair, this refers to the choice of a symptom. Sometimes hair pulling, of all the things that you could be doing, hair pulling has this element of randomness. Maybe you will see someone cut their split ends off, or you will see a friend or a parent or a cousin pulling their hair. I've had clients, quite a few of them over the years, who learned to pull their hair from a parent. A mother will tell her daughter that having split ends is not good, and that she can just break the hair. I mean, obviously that kind of creates another split end waiting to happen, but that's something that I've heard times over and over again. So that means that hair pulling is can be a pattern that repeats within a family. It can be something that results from your mom's best intentions, which makes it difficult to let go. And then at the same time, I've had clients for whom attacking the hair is actually an attack on a certain type of femininity or womanhood, and it's almost like a psychological slash political protest in a way. I'm attacking a part of me makes me that makes my gender role be a certain way. And the same goes for men. I'm not talking only about women here, because I've had a number of male clients over the years who would pull their beards, for example, and then when you suggest something as simple as stimulus control, so shave your beard, and then you'll have nothing to pull, they almost gasp at that. They don't like the idea because they tied their beards either sometimes to their religion and then sometimes to the actual idea of what a man is supposed to look like. So I'm essentially suggesting that they should get rid of their manhood, which, I'm not, but that is how it's heard. And that means that hair has symbolic significance for us. And depending on what that is for you, since we are all quite different, we can perhaps assume some things based on the cultures that we're from. But this is something that's very much worth considering. Maybe not for the practical techniques, but certainly for long-term outcomes. Sometimes pulling is precisely important because it deals with something that is so important symbolically. And in that case, you will be more reluctant to give it up. So let's see so far I've been talking mainly about what obstacles people encounter and what is it that you need to factor in terms of lowering your expectations for change. But let's see what properties, skills, or capacities that you could have that should actually be signs that you will change faster. The good news is, even if you don't own too many of these at this time, all of them are skills that you can develop. So patience is always your ally when it comes to change. If you remember in the beginning, I was talking about how we change and what our patterns of change are. That was quite important, and this is where patience comes into play. If you're patient with yourself, that means that you will be able to accept how you change more easily and then make the best use of that pace. If you can't accelerate it past a certain point, accepting and being patient with yourself will actually help you achieve better results. I don't have a particularly, woo, deep, mystical explanation of what patience is. For me, patience is just acceptance of a pace that you cannot alter. It's just as simple as that. If you struggle with being aware and being mindful of, let's say, unconscious pulling, you have to be patient, because if you're not patient, you will just add and pile on frustration that will additionally trigger you. So patience protects you and accelerates change, whereas lack of patience just makes things worse. The second thing is discipline. Discipline, simply put, is willingness to take action in accordance with your values to achieve a specific goal. So if you're a disciplined person, if it's clear to you, if you want to build discipline, take a look, but an honest look into what your values are. So not what you say that your values are, but what your values actually are. The difference is that we all say what our values are. Like, we'll all say that we like to be, I don't know, like open, tolerant. We love our families, friends. We want to be the best version of ourselves and yada, 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 all this. But that doesn't necessarily mean that that's actually our value. If we don't put our actions, behind our words, then what we say is not a value so much as an empty statement. So be very clear with yourself what your values are and see if your values actually support you quitting pulling. This is quite important because then you can set your goals based on your values and work towards them. That's what discipline is. If you've been to, I think it was the last webinar or the one before that, when we talked about discipline, you might remember that I railed against willpower because I don't think it's a very efficient way of changing. So I don't mean willpower here. Discipline comes from an honest intrinsic desire to change, whereas willpower is just you having a lot of strength and pushing yourself through something. And these are quite different. Willpower might carry you for a month, but then you'll have a relapse. Discipline is much more intelligent. Discipline is contemplative. It gets you to reflect, to think, to strategize. So discipline is definitely something that you can use to accelerate change. Discipline is also something that you can develop. So if you don't have it right now, it's something that it's a skill. It's not like a God-given gift. It's a skill that you develop. Self-compassion is a big one because self-compassion eliminates a whole layer of triggers because you're not going to be very hard on yourself when you have a relapse or a particularly difficult pulling episode. Instead, self-compassion invites you to reduce your own suffering. So having self-compassion will reduce some triggers, but at the same time, self-compassion is actually what motivates change. Because if you don't have the desire to alleviate your own suffering, what exactly will get you to stop pulling? Another one is openness and vulnerability, and I would go ahead and connect that to trust. Because when I refer to these, I mean specifically you in therapy. How much are you willing to share? How much do you choose to keep to yourself? How vulnerable are you willing to be in front of your therapist? And that, at least in my mind, obviously ties into how much you trust your therapist. If you have a difficult time opening up to people, again, that means that change might be somewhat slower because for therapy to work, you need to be able to open up to your therapist. That's just how change works in therapy. Therapy is not like writing prescriptions where if you tell me you have a headache, I don't really need to know. I see a lot of you are reacting to this one, raising your hands. Please just type in the question. I'm almost done. Let me see the time. Yep. I'll be done in about 5 to 10 minutes and then I'll get to your questions. So type them in and I will get to as many questions as I can. Where was I? Yes. Opening yourself up. So when you go and see a doctor for a physical symptom, let's say you have a headache or you have, I don't know, like elevated blood sugar or something, you don't need your doctor doesn't need to know how you feel about the headache and what that means to you and what associations you have related to that headache. He just needs to know how to classify the headache medically and then give you appropriate treatment. In therapy, those intimate, deep thoughts are what we work on and work with. So you have to be able to open up. This is not something that you have to do on your own. I like it when my clients tell me I struggle to open up. Here's what we can do to make it easier for me. I think that's perfectly acceptable. In fact, I found that doing therapy in writing, like we do at Trickstop, actually has advantages for people who are afraid to open up to someone. Because when you do something in writing, you don't actually have to look at my face while you're typing something. You're typing and you know that you can type as much as you want and you'll get your response in a day. So it's easier to say those unpleasant and difficult things. On the other hand, because everything is in writing, then you can't really repress it later on. It'll stay there just staring at you. So in that sense, it's a double-edged blade. Sometimes it's easier to open up, but at the same time, you can't really unsay something. It's just written there, it's submitted, so it'll stay there. And then in the end, there's willingness. It's last on the list here, but it's by no means the least important thing. There will be, as you go through therapy or any kind of process of change, truly, there will be techniques or ideas that might seem ridiculous or just downright bizarre, and you might be tempted to resist trying them out. That, if that's the kind of pattern that you have, that you're not very open to trying different things, then change might be difficult for you because lack of willingness is quite literally the opposite of change. There is no change unless you try something new. If something new seems silly, it might not be because it's silly. It might be because that's your resistance talking. Some techniques seem silly, but they still work. Most therapists will give you techniques that they know that work. So in that sense, being willing to try out different things, which also means that you're willing to face failure as well, potentially, that will carry you a long way. Because unless you fail a couple of times, you'll have a really hard time finding appropriate techniques for you. So now let's answer this question. Reduction or stopping? What is it that you should expect, and what's a better goal to set? So I see again a few of you raising your hands. I quite literally have 3 slides left, so please type in the questions in the Q&A. There's a button there, you can press it and then type in the question and I will answer it. Let's consider let's not, I don't like to give these, sometimes, let me try and phrase this. So sometimes people tend to talk about BFRBs as chronic conditions. I like to avoid this. And the reason why I like to avoid this is because I feel like when people start treatment with the idea that something is a chronic condition, therefore something they'll never get rid of, then they will really set low expectations. They'll just settle with these small replacement techniques and they will be hesitant or even kind of oblivious to any deeper issues. So I don't like to think in terms of what's chronic and what isn't. You can get a respiratory virus, 100 times in your life, but you would never call that chronic. So you can stop pulling, you can perhaps start again, but you don't have to. But the fact is you can't stop. So stopping is possible. That's as simple as that. And it's not a wrong goal to set per se. But in my opinion, the best way to get to stopping is through reduction. So for me, these are not like either or. For me, they're quite complementary. And let me unpack that just a little bit more. What is a useful goal? So first of all, as I said, stopping completely is a valid goal, but it's a long-term goal. A long-term goal becomes attainable or more attainable when you break it down into smaller goals. So fine, ultimately stopping and never pulling again, a completely valid goal. The trouble, although I have to add this with the goal of stopping, is that you will never know whether or not you achieved it. Maybe you don't pull for 6 months or for a year or 2 years or 3 years, but you can always say, yeah, but I still have decades ahead of me. So in that sense, if you set that as the goal, you might feel like you've never accomplished it, even if you don't pull, because you might think, okay, I could start pulling again tomorrow. So then it'll turn out that I didn't achieve my goal. So it's not a very measurable goal. And also it is something best thought of as a long-term goal. I would think of that as the map rather than the territory. So something to contemplate theoretically, but not something that's wise to occupy your mind too much practically. Incremental change is far more realistic as an approach. I usually tell my clients, as kind of a rough estimate, just aim to pull 10% less per week. It won't be possible every week because change is up and down. But consider this. Let's say that you actually manage to reduce pulling by 10% every week. That means in 3 months, give or take, you'd be able to give up pulling completely. So 10% might not sound like a lot, but it actually is a huge thing. So stick to what you can achieve. That's even 10%, take that with a grain of salt. See what's achievable to you, then push yourself a little bit more outside of your comfort zone. You need to challenge yourself because that's how we change, but you don't have to overwhelm yourself. And this is very, very important. And also, whenever you succeed in these small, increments, always reward yourself. This part is quite important because if you want your brain to remember what it's supposed to be doing, then you need to reward it when it does something well. We react and learn much better from validation than we do from invalidation. So being hard on yourself when you fail is not going to lead to improvement. But being extra good to yourself when you succeed is. What's not a useful goal? As I said, you need to be careful not to overwhelm yourself. So taking a step out of your comfort zone is a good thing. But going a mile outside of it is not only a bad thing, it can actually be quite harmful. Because when you set expectations so highly, then the disappointment will be that much more intense. And that will lead to you losing motivation to change very likely. When you set goals out of impatience and you fail to acknowledge the realistic context in which you can change, again, you're setting yourself up for failure. Being impatient about change is really like a logical thing to expect. We all want to change quickly. But that also means that we miss so many factors because we're just focused on getting there as fast as possible. And then we don't actually see the obstacles and we stumble over them. So if you feel impatient, just immediately dial back your expectations. Expecting yourself to stop in a specific time frame isn't very useful because it puts undue pressure on yourself. There are many things about change that you cannot predict, external factors that might trigger you, difficult times. If we could have learned anything from the past few years with the wars and the pandemic and the crisis of this or that kind, it's that there's so much that we can't predict and so much that we can't control. So setting firm dates is really never very useful. It's also not possible to change while expecting your life to stay the same. If you pull because you're overworked, you have to reduce your workload. That might mean that you have to redefine your career goals, that maybe you'll make a little less money, but that sometimes is a sacrifice that has to be made. I know this is not a very pleasant thing to hear, but I'm trying to be as straightforward as I possibly can. It's really not possible to change while still continuing to do the same thing. I've had clients who actually decided to choose pulling instead of, giving up on their ambitions when push came to shove. And that's a legitimate choice to make, and every adult has the right to make that choice. It's just that it's not possible to change without changing some other things as well. What exactly is something that you will figure out as you go through the process. And then, of course, defining a way of changing that doesn't align with your actual experience of change is just to put plainly self-sabotage. There are some people who don't want to change slowly and who don't want to have those, incremental changes and who want to just stop immediately. For most clients, to be perfectly honest, this isn't a very realistic way to approach change. Just stopping usually relies on willpower, and willpower is a very limited resource. So just stopping means that you will force yourself to ignore the urge for a while. And what will happen then is that you will just have a relapse afterwards, right? But if you do prefer this all or nothing approach, then I suggest that you cooperate with your therapist. Decide when the time is right to implement that approach, and then maybe implement it in well, all or nothing, but in small steps. If you have 3 or 4 pulling sites, try to eliminate one, and then don't pull at all there, and then try to reduce on other sites. And then when this change stabilizes, you can apply the same principle on another pulling site. But it's very, very difficult to simply stop and then maintain that for longer periods of time. Is stopping completely realistic? I'll be very clear here. Can you stop pulling? Yes, you absolutely can. Can you stop feeling the urge to pull? Well, the short answer to that is no. The problem, a part of the problem is that people tend to pathologize the urge itself. They tend to think of this urge to pull as if it's something that they should never feel. And redefining the way we relate to feelings is actually one of the goals in psychotherapy. You can't not be sad when something sad happens, right? If you're human, if it's sad to you, you'll be sad. The same goes for the urge. The way that I like to talk about emotions, and I believe we had a few webinars on this over the years, is to think of emotions as being information. With pulling, you're simply mistranslating the urge to pull as I have to pull. Whereas there are other ways to conceptualize it so that you can actually befriend this feeling, so that you can make use of it, approach it constructively. Sometimes perhaps the urge can tell you that you need to take a break. Sometimes it tells you that there's something wrong in your relationship. Sometimes it might tell you that you don't actually like your job or whatever else. This is very individual. But the point, one of the things that we do in therapy is not to perform, some kind of weird magic where we eliminate feelings, because we can't choose what we feel. We can learn from those feelings and then perhaps minimize them, make them, few and far in between. But feeling the urge is something that you're capable of feeling, and you will very likely feel it again. But feeling the urge doesn't mean that you have to pull. So can you stop pulling? Yes. Can you stop feeling the urge? Probably no. Can you learn to approach the urge differently? Absolutely yes. So this is quite an important thing, because it's kind of like if you struggle with an anxiety disorder and you go into therapy expecting never to be anxious, you're guaranteed to fail. The same goes for this. Feeling stuff is normal and there's no way around it, right? So we have to learn how to work with our feelings constructively. This is all that I had for this evening, and I'm going to close the poll and then go to your questions. I see that some of you are still raising your hands, so once more, just type in the questions and then we'll get to them.